What is the risk of wound infection occurring 43 years old man who undergo laparoscopic cholecystectomy for uncomplicated biliary colic? So it is very obvious that in case of the laparoscopic cholecystectomy, which percentage of the wound infection? That means what is the percentage of the wound infection in case of the laparoscopic cholecystectomy? We know the cholecystectomy, that means it is the, here we can see there is the liver and here the gallbladder. So when laparoscopic removal of this gallbladder it is done, it is usually not contaminated wound. So in this condition the chance of infection is very less. We know there are different type of the wound, such as the clean, contaminated and dirty. But here in this cholecystectomy procedure it is very clean. Usually it is very clean, not clean contaminated. Sometimes clean contaminated may occur when there is spillage of the bile within this peritoneal cavity, but it is very less in case of the laparoscopic cholecystectomy. So as it is the very clean wound, so in this condition the wound infection rate is very low. And here the percentage 1, 4, 15, 20, 30. So 15, 20, 30 usually they will not be answer. Our answer will be located within the 1 and 4 because this is very clean wound or clean contaminated wound. So in this condition it will present within 1 or 4. So let's see. Now see, it is straightforward uncomplicated laparoscopic cholecystectomy. That means the laparoscopic cholecystectomy usually very uncomplicated, and wound infection rate is 3 to 5%. So it is very less, 3 to 5%. This infection rate is very less. The use of antibiotic in this group is therefore unnecessary. Actually in this condition usually no required out of antibiotic. That means as it is very clean wound, like it is nevus or lipoma or CBCS. So in like this condition, that means which is the clean or very clean, in this condition the antibiotic usually not required. Complex procedure, bile spills and acute cholecystectomy has higher infection rate. That means when there is the bile spills occurs and when there is biliary peritonitis, in this condition there is high rate of infection. But in case of the uncomplicated laparoscopic cholecystectomy procedure, there is very less chance of the infection, and antibiotic should be administered to this patient. That means when there is bile spillage, when there is contamination, in this condition antibiotic are required. So what is the risk factor or percentage of risk factor in case of the laparoscopic cholecystectomy which is uncomplicated? It is 2 to 5% or 2 to 4%. Here we can see the 4%. So 3 to 5% or 3 to 4 or very less, so it is 4%.